Welcome to Capsule RN, where nursing school just got easier.
Meet Frank, a patient with chronic obstructive pulmonary disease who has come to the ER due to shortness of breath. His SpO2 level is currently 86% on room air. The nurse applies supplemental oxygen to the patient according to the doctor's orders. What typical SpO2 target saturation range could be expected for a patient with COPD? Is the answer A, 95 to 100%, B, 91 to 94%, C, 88 to 92%, or D, 86 to 90%? To answer this question correctly, we first need to understand some things about oxygen saturation. So what is oxygen saturation actually? Simply put, oxygen saturation is a measurement of how much oxygen is being carried in the blood. The measurement is taken by placing a sensor with a red beam on a finger, toe, or ear, for instance, and the device is then able to give a reading for an estimated amount of oxygen that saturates the blood. The reading is given as a percentage, either on the device itself or on a monitor that the device is connected to. But wait, what is SpO2? Is that the same thing as oxygen saturation? The answer is yes. The symbol for oxygen saturation is SpO2. Actually, oxygen saturation has a multitude of nicknames. The non-invasive device used to measure oxygen saturation is called a pulse oximeter. So you will often hear the term pulse oximetry or pulse ox used interchangeably to mean oxygen saturation as well. In addition to that, you may also hear oxygen saturation shortened to oxygen sat or just SATs. So oxygen saturation has many nicknames: SpO2, pulse oximetry, pulse ox, oxygen sat, and SATs. All of these refer to the same thing, the measurement of the level of oxygen in the blood. When charting or giving a report on a patient, you want to include a patient's oxygen saturation level, but also note if the patient is or isn't receiving oxygen from a device, such as a nasal cannula. Examples of how you would say this in a report would be something like, the patient has a pulse ox of 98% on room air, or the patient's oxygen saturation is 99% on 2 liters nasal cannula. Now, before we go on, we need to differentiate two words that you will hear a lot when talking about low oxygen. These words are hypoxemia and hypoxia. Both relate to low oxygen, but one is low oxygen in the blood, while the other is low oxygen in body tissues. Remember that oxygen is breathed in through the lungs and attaches to the protein hemoglobin on red blood cells in the blood. Once attached, the oxygen is carried on the red blood cells through the blood until that oxygen can be delivered to body tissues so that they can survive and thrive. Now, if not enough oxygen binds to hemoglobin on the red blood cells, then the result is low oxygen in the blood. This is called hypoxemia. However, sometimes the problem isn't the level of oxygen in the blood, but that the oxygen can't get into or be utilized in the tissues for some reason. If the low oxygen is in the tissues, we call that hypoxia. With that being said, we now know that the issue can sometimes be hypoxemia, sometimes hypoxia, but often the two go together because low oxygen in the blood, or hypoxemia, will naturally and quickly lead to low oxygen being delivered to the tissues, causing hypoxia. Nurses regularly check a patient's oxygen saturation level to tell if the patient is well oxygenated or not. If a patient is not well oxygenated, this can quickly have grave effects on body organs and can be life-threatening. We need to mentally know how to categorize oxygen saturation readings for the normal patient. There can be slightly varied categories for these readings, but don't get hung up on that. Know the normal blood oxygen level, which is 95 to 100%, and anything lower than that for the quote-unquote normal patient needs prompt action for the situation at hand. This is especially true with pediatric patients whose oxygen levels can drop extremely quickly when not in the normal range. Let's go through each of these categories now in a little more detail. The first category is a normal oxygen level, which will be 95 to 100%. As a general rule, if your patient has a reading in this category, there is no further action that is usually needed. The next category reading is a mildly low oxygen level of around 91 to 94%. If you get an abnormal reading, there are several things you will want to check. First, check the placement of the probe, as it may just not be fitting snugly around the finger or some other minor fix like that. Next, make sure the issue isn't the blood pressure cuff. If you're taking a patient's blood pressure at the same time you're checking the oxygen saturation level, and both devices are on the same arm, you will get a faulty low SpO2 reading whenever the blood pressure cuff tightens around the arm. This is because during inflation of the cuff, less blood is able to get to the hand, and without normal perfusion, the SpO2 reading will not be accurate. An easy fix for this is to always place the O2 sensor on the opposite side as the blood pressure cuff. That way you don't even have to worry about losing your O2 reading and wasting time due to an inflating blood pressure cuff. Another thing you can check is to make sure your patient doesn't have fake or painted nails, cold fingers, or is moving or shaking about. All of these things can cause a falsely low SpO2 reading. Also check the waveform of your reading on the device or monitor, since the shape, height, and consistency of the waveform can help you determine if the reading is accurate, artifact, or a low perfusion issue. With an accurate reading, you will see a tall, well-defined, consistent waveform, such as the white line in this picture. Lastly, spot check another location, like a different finger or the ear, for instance, to see if the first location you chose just wasn't the best placement for that patient. Just make sure you give the device enough time to pick up the reading accurately before you decide to move the probe again. Usually it takes around 10 to 30 seconds. If your SpO2 reading is still low after checking and making necessary adjustments, have the patient sit up in bed or elevate the head of the bed, because oxygen exchange can't occur very well when a patient is lying down. In addition, have the patient take some deep breaths and cough to clear their lungs. And if they have one, you can instruct them to use their incentive spirometer to take some deeper breaths. Notify the doctor of the situation and begin supplemental oxygen as appropriate to get the oxygen level back in the normal and ordered range for that patient. The third category is a moderately low oxygen level of around 86 to 90%. If a patient's oxygen level is in this range, immediate and appropriate action should be taken for the safety of your patient. Actions include keeping the head of the bed elevated, having the patient take deep breaths and cough, suctioning the patient if the airway isn't clear, applying the appropriate device and amount of oxygen, and notifying the proper healthcare team members promptly. The final category is a severely low oxygen level, less than 85%. This is a critical level in which the brain is affected as it isn't receiving the oxygen it needs to function properly. In such an emergency like this, prompt and immediate action is crucial. Immediately apply 100% oxygen with the appropriate device, and from there take all other appropriate steps for the situation without any delay. Now, what are signs and symptoms of low oxygen? Initial symptoms may include rapid breathing, shortness of breath, tachycardia, which is high heart rates, and confusion because the brain isn't getting adequate oxygen to function properly. Late signs and symptoms, however, that you want to be aware of are bradycardia, which is a slow heart rate, and cyanosis, which is a bluish tint to the lips, hands, and feet. In review, regularly check and chart your patient's oxygen saturation level according to your facility protocol. If an oxygen level is anything but normal, which is 95 to 100%, take prompt and appropriate action, making sure you chart that you notify the doctor's orders, your actions, and all reevaluations until your patient has a normal oxygen saturation level again. Now that we have talked about what is normal and abnormal for the typical patient, we need to talk about an exception to the rule, and that is with COPD patients. Patients with COPD have lower SpO2 baselines, usually around 88 to 92%. Giving a COPD patient excess oxygen to raise their SpO2 level too high is actually very detrimental because the COPD patient is driven to breathe in the presence of a lower blood oxygen level. Too much oxygen in a COPD patient can take away their drive to breathe, and carbon dioxide builds up in their system. This is why the doctor will likely order a COPD patient's target SpO2 range to be 88 to 92%. Make sure you know your COPD patient's SpO2 target range and titrate supplemental oxygen to match the doctor's order. Remember the situation with Frank? What typical SpO2 target saturation range could be expected for a patient with COPD? Is the answer A, 95 to 100%, B, 91 to 94%, C, 88 to 92%, or D, 86 to 90%? If you said C, 88 to 92%, you are correct. A typical order for a COPD patient's target SpO2 range is likely to be around 88 to 92%.
Thanks for being part of the Capsule RN community. If this video added value to your studies, please hit the like and subscribe buttons. We are excited about releasing more and more content in our continued pursuit of making nursing school easier.